you as healthcare providers need to make sure you've put in place or updated your policies and protocols and that you're prepared and protected. The purpose of today's webinar is to give you an overview of HIPAA and its basic requirements, including penalties associated with failure to comply, but also to introduce you to some of the free resources that Department of Health and Human Services has produced and published online that can assist you in compliance activities required by the law. There are a host of challenges unique to rural healthcare providers, changing reimbursement models that threaten to decrease both private and federal reimbursement, lower income patient populations, and a low ratio of healthcare professionals to patients, and just generally limited manpower and resources. This last one is true for most sole practitioner or small group providers, and almost without exception, providers would rather devote their limited resources to patient care, not to business and operational strategy or federal regulatory compliance. And so today I'm going to give you some practical, actionable advice to help you as rural providers implement or improve your HIPAA compliance and strategy. And I'll provide, as I mentioned earlier, links to free HHS materials that could help you do this in an inexpensive and efficient a way as possible. Before we jump right in, I'd like to give you a little bit more background about me and my colleagues. I am a healthcare attorney at Nixon Law Group and a principal at Redbird Law and Consulting, LLC. I started my career at the Centers for Medicaid and Medicare Services, where I focused on Affordable Care Act reform, technology, and privacy and security issues. I continue to focus on these issues today in my current practice. I'm also a member of Healthcare Solutions Connection, which is a national network of expert healthcare consultants serving providers, insurers, developers, and vendors in the healthcare industry. My colleagues and I have a shared goal of helping healthcare entities adjust to the rapidly changing healthcare landscape we face today, both from a legal and operational perspective. And because it's relevant to today's topic, I've listed some of the relevant services I can provide, but I won't go through all of them here. I will mention that through Healthcare Solutions Connection and their network, I have access to folks who provide what I would call HIPAA-related services, such as support for capital acquisition of health IT and electronic health record technology, and HIPAA cyber liability insurance coverage. I'm probably preaching to the choir here, but as I mentioned earlier, rural providers have some very real challenges that can be a barrier to their ability to comply with HIPAA. Tough staff and budget constraints can logistically make it difficult to complete things like risk assessments and proper notice procedures, but there's also often a lack of local HIPAA expertise and technology-related challenges. I'll just note here that while this can seem like an overwhelming undertaking, HHS is aware of these unique challenges, and it is for this reason that they leave a good amount of flexibility in the HIPAA regulations. They're not completely prescriptive about how you must meet their standards, and they don't expect a two-doc practice in Roanoke has the resources of Bon Secours and Richmond. They evaluate compliance with these resource differences in mind. Even small steps toward compliance can go a long way during a HIPAA audit or enforcement action. The Health Insurance Portability and Accountability Act of 1996, or HIPAA, that's two A's, not two P's, you see that a lot, is a federal law designed to protect the privacy, security, and confidentiality of health information. HIPAA was recently amended by the Health Information Technology for Economic and Clinical Health Act, or HITECH. This law greatly increased penalties for HIPAA violations, which we'll talk about a little bit later. HIPAA applies to covered entities and to business associates. These are defined in the law. Covered entities are health plans, healthcare providers, and healthcare clearinghouses, which are entities that transmit or receive health information and convert them into standard transactions. These include things like billing services and health management information systems. A business associate is a non-employee person or organization that performs work or certain functions on behalf of a covered entity that involve the use or disclosure of protected health information. This can include accountants, lawyers like me, and IT vendors. Keep in mind that you as providers can be both covered entities and business associates based on your relationship with other covered entities. HIPAA requires that all business associates must have a contract known as a business associate agreement signed before PHI can be shared, and based on amendments to HIPAA, In the HITECH Act, both covered entities and business associates must abide by HIPAA and are subject to enforcement under the law. Because all of this relates to protected health information, or PHI, as I said just now. I'll quickly define that term as well. PHI is individually identifiable information in any form, including electronic, paper, or verbal, that is held or transmitted by a covered entity or business associate. It's PHI if it relates to the health condition of the patient, the provision of care to the patient, even the payment for the provision of care. So that includes billing records. If the information can be reasonably used to identify the individual, it's covered. This includes PHI disclosed in an email, in a billing statement, in a conversation you're having, in a text message. It does not just include medical records. There are two basic rules under HIPAA about how we use, disclose, and maintain patient information. Those are the privacy rule and the security rule. Privacy rule establishes national standards to protect medical records and other PHI. It gives individuals rights regarding access to their own PHI and permits the use and disclosure of PHI for limited purposes by covered entities and business associates. Generally, PHI can be shared with the individual, him or herself. PHI can be shared with an entity other than an individual for limited purposes, including the treatment, payment, or internal operations, if required by law, or if the covered entity receives a signed permission by the patient. You may, but are not required to disclose PHI to a patient's friends or family members, but only in specific circumstances. That is, if the patient agrees or consents to the sharing of his or her information, if it's an emergency situation or the patient is unable to communicate, or if the patient is deceased, you can use your professional judgment to disclose only relevant or limited PHI to friends and family. And if the patient is a minor or has a legal guardian, you can disclose PHI only to the parent or legal guardian. And if that person gives you permission to disclose it, then you can communicate with other friends and family members as well. The privacy rule also establishes patient rights and covered entity obligations regarding PHI. Those are the right to receive a notice of privacy practices, which is a document that specifies the ways that covered entities will use and disclose the patient's PHI. The right to request restriction of use for treatment payment or healthcare operations. Covered entities have the right to refuse this kind of request, but if they accept, they have to abide by it. The right to request that a covered entity send communications containing PHI by an alternate means or at alternate locations. The right to access, inspect, and obtain a copy of PHI when held in a covered entity's designated record set. That would be your medical record, basically. The right to have a covered entity amend PHI held in a designated record set to ensure that the information is accurate and complete. And the last is the right to receive an accounting of all disclosures of PHI made by the covered entity for the 6-year period prior to the date of the request. Now, in reality, the accounting is not required for many of the common disclosures, such as disclosures to the individual, disclosures for treatment, payment, and operations, and the like. Each of the above rights have associated exceptions and process requirements. So to form your specific protocols, you'll want to explore the free HHS resources I'll talk about later, or check the regulations themselves at 45 CFR, parts 160, 162, and 164. The HIPAA security rule establishes national standards for appropriate administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and security of electronic PHI. For those providers that don't have electronic records or make electronic transactions, I know that there are still some of you out there. This rule does not apply to you, but for those of you that transmit PHI electronically or who maintain PHI in electronic media, I'm talking to you here. To grasp your responsibilities under the security rule, it's helpful to understand the key terms I mentioned above. Confidentiality means that the data is not made available or disclosed to unauthorized persons or processes. Integrity means that the data have not been altered or destroyed in an unauthorized manner. Availability means the data is accessible and usable on demand by authorized individuals. The HIPAA security rules address both technical and non-technical safeguards that the covered entities and business associates must put into place to secure PHI and requires them to adopt administrative, physical, and technical safeguards defined in regulation. Some of these standards are required and some are deemed addressable, which means that you have the discretion to assess whether it's reasonable and appropriate for you to implement that safeguard. This is part of the flexibility that HHS has built into the law. Administrative safeguards are things like establishing and evaluating policies and protocols for information access, security incidents, employee training, and execution of business associate contracts. Physical safeguards are physical measures, policies, and procedures that protect your electronic information systems and related building and equipment from natural and environmental hazards and unauthorized intrusion. These are things like having locks on your doors. Facility access controls, workstation security, Kimberly, hi. We are on the right slide. I'm going over the security rule here. I just didn't want to put all this detail on the slides. Technical safeguards describe how a person implements administrative safeguards. These are the technology and procedures for its use that control access to PHI. These include the use of user IDs, passwords, audit, and access controls. You can use HIPAA-compatible software solutions that meet these safeguard requirements, but I should note that just having a technology that says it's HIPAA compliant isn't enough. The security rule also requires that you put together protocols for the physical safety of the records and that you have all of the related documentation, policies, and procedures completed. There's two additional provisions of HIPAA that are worth noting here, the enforcement rule and breach notification. The HIPAA enforcement rule establishes the framework relating to compliance and investigations, determining the amounts of civil money penalties for HIPAA violators and hearings procedures. HIPAA also carries criminal penalties, I should note. HHS can impose civil penalties of up to $1.5 million a year, and DOJ, the Department of Justice, can impose a fine of up to $250,000 or imprisonment for up to 10 years. And lastly, I promise, breach notification. A breach is an impermissible acquisition, access, use, or disclosure of PHI in which the security or privacy of the information has been compromised. Examples include lost or stolen USB sticks, email strings with patient information sent or forwarded to the wrong person, a stolen laptop, or private records left in a public place. If you suspect or know that a breach has occurred in your practice, it's very important that you notify the HHS Privacy Office. In addition, the HITECH Act made a significant change to HIPAA breach reporting requirements. Under the old rules, and this is of last year, under the old rules, reporting them was not required unless you determined there was a significant risk of financial, reputational, or other harm to the individual whose records were subject to the breach. Under the new rules, unauthorized disclosures of PHI are presumed to be breaches requiring reporting unless you as covered entities can demonstrate a low probability that the breach was remedied before it could cause a vulnerability or before the information was accessed. Practically what that means is if any breach of information occurs, you have a responsibility to conduct a full risk analysis to determine whether the incident can be mitigated so that it doesn't constitute a reportable breach. There are also resources to help you do that, so we can talk about those as well. The breach notification rules also require that you provide notice to HHS and to the individuals affected within 60 days. So I know that's a lot of information to take in, but that is basically the broad overview of the most significant elements of HIPAA. In terms of the tools you should have in your HIPAA arsenal, the first thing HHS will ask you for in the event of a potential audit or violation is your security risk assessment. That risk assessment helps you ensure that you're in compliance with HIPAA's administrative, physical, and technical safeguards. It also helps reveal areas where your PHI could be at risk, so it's also a sort of preemptive useful tool for you to start planning your policies. HHS recently released a security assessment tool for providers, which I'll show you in a few moments. You'll also want to make sure you draft and or update your business associate agreements and your notices of privacy practices. There have been changes since last year. You should try to establish media use, authorization, and inventory logs. For instance, make sure you have records of who has access to your computers, your files, and other physical spaces where PHI might be. You should also have breach or unauthorized use policies and procedures, as well as patient rights policies and procedures. I've already reviewed the major enforcement and penalty provisions with you, but I just want to reinforce how important it is to take these requirements seriously and to begin now with your efforts to comply. This year, we've seen some of the largest HIPAA settlements in history. I put a couple examples here, and administration officials have basically said in recent weeks, you ain't seen nothing yet. There's going to be a lot more, a lot bigger money settlements, and because of the audits, these are going to be proactive rather than resulting from notifications by the healthcare entities themselves. The Omnibus rule, published last spring, implemented the significant penalty increases from the HITECH Act. In addition, this fall, as I just mentioned, the HHS Office of Civil Rights will begin on-site and desk audits of covered entities to assess HIPAA compliance. It is no longer reasonable to assume that HHS won't come to your door to ask you whether you're complying with this law. A couple of things they're focused on now, just for your edification, are the use of mobile devices that contain PHI. There are a lot of doctors' offices that are communicating via text, via cell phone, that are accessing emails via cell phone. These are big areas of vulnerability for HIPAA compliance. They're also looking at the security of digital copiers, and as I mentioned before, the use of the risk assessment and destruction and disposal of PHI. So to give you some practical starting points, I've made a short list of things you can do right now to get started. You can conduct a gap analysis, comparing your existing policies and procedures to new requirements. You can conduct a security risk assessment, which should be done regularly, at least annually, but that you now have a tool for, which we're still getting to. Identify and document business associate and subcontractor relationships, so that anybody who you contract with who has access to your private health information, that they are a business associate of yours, and you need to have a contract in place explaining to them what their obligations are to protect that data. You need to verify that agreements, notices, and authorizations are in place and updated as necessary. This includes your notice of privacy practices. You should develop or update your HIPAA compliance training and education programs. There are also free resources to help you do that. You should revise breach notification policies and procedures. The slide I'm going to show you with some of the free resources, there's a link to official breach notification policies that you can use. And you'll want to update training and provide ongoing awareness communications. So this is the money slide. Here I've included links to some free resources for you to use to help complete some of the tasks that I just laid out. I will make sure that the links on this slide are available to you after this call. Some of these documents can form the basis for your HIPAA compliant policies, documentation, and protocols. First, you should be aware that there are resources to help with all health IT and electronic health record needs through the ONC, that's the Office of the National Coordinator, the ONC Regional Extension Centers. They are free resources. The link here will take you to the page where you can search for your contacts at your regional extension center. And these centers can also help providers, they say, bridge the technology gap by helping you navigate the EHR, electronic health record adoption process, from vendor selection all the way to implementation and meaningful use. I've also included links to business associate agreement templates, a model notice of privacy practices, some privacy and security training games for employees that HHS created, a patient authorization form for disclosure of protected health information, instructions for submitting breach notification notices to HHS, and finally, a link to the new HHS Security Risk Assessment tool. Until this year, there was no easy way for a provider to do their own security risk assessment. Understanding that this can be pretty challenging and sometimes expensive, ONC developed this tool to help guide providers through the process. As with any first-generation tool, it has its glitches and drawbacks. It is more user-friendly than any past tools have been, but they continue to work on it. The other important piece here is that it's free. So the providers can download this tool from an HHS website onto his or her computer, use the tool to document and store the all-important security risk assessment. The tool can serve as evidence of reasonable efforts to comply with the HIPAA security rule, which will come in handy should you face an audit or a violation action. The way the tool works is that it takes you through each HIPAA requirement, citing the relevant regulatory citation, asking you questions about your practice, and depending on your answer, allowing you to document your proposed corrective action. Resources are included with each question to help you understand the context of the question and the potential impacts to your PHI if the requirement laid out is not met. You can use the tool to document your answers, comments, and risk remediation plans directly, and the tool will serve as your local repository for the information. The tool does stay at your computer and will not send your information elsewhere. So if your computer is secure, the data that you enter into the security risk assessment tool is secure as well. The tool can also create reports exportable to PDF and Excel. The picture here is an example of one of the pages. This is section 164.310A23, which is one of the requirements that's addressable. Again, that means that you have to use your judgment to determine whether it's reasonable for you to implement this security provision. This one says, do you take steps necessary to implement your facility security plan? If you look over to the right side of the screen here, there are explanatory tabs that will help you understand what they mean by your facility security plan and what the expectations are. What you can do here is you can document your current facility security plan, how you're implementing it, say you're doing that or you're not doing that, and say and describe what level of vulnerability you think applies to this particular area. Again, if you have questions about this, you can reach out to your regional extension center or, of course, to me. I guess one more thing, that this assessment is going to take a serious investment of your time, realistically, but you can start and stop as many times as you want, completing it gradually. I want to stress that HIPAA is not an all or nothing set of requirements. It can seem overwhelming when you look at the whole, but there are really great places for you to start here. Use the free tools I've included to make sure your patient privacy notices are up to date and that you have proper authorization forms. Make sure you have an updated business associate contract with any of your vendors that may have access to your PHI. Include the breach notification procedures in your policies and procedures manual, and use your regional extension center resources. Most importantly, I would recommend that you download the security assessment tool and just look around. You can do this gradually, and if you're hit with a HIPAA violation or an unexpected audit, evidence that you've taken steps toward completing the assessment will help you in your negotiations with the government. So that is the close of the presentation. If you have any questions, please type them into the chat box. My colleague Carrie Nixon and I are here to answer any questions you have while you're on the phone. I can certainly go back to any slides that you want to look at again. You can also visit our website at www.healthcaresolutionsconnection.com, or you can email me or my colleague Carrie Nixon to ask any other directed questions. So I got a question from Kimberly. If there is a breach, you are required to notify the HHS privacy office, and any individuals that are the subject of the breach. So if you had a set of medical records that were left somewhere, all of the individuals whose medical records were in that group of documents, you would be required to individually notify each of them. So I sure can. Kimberly asked if I could discuss some of the changes in the breach laws. So the major change is the standard that governs whether you have to report a breach or not. So under the old law, if there was a breach, you could assume that you didn't have to report it unless it was going to cause reputational, financial, or other harm to the individual whose records were breached. The new standard as of last year is that every breach is considered reportable until and unless you complete a full risk assessment to determine how to mitigate the breach and whether the mitigation can occur prior to any vulnerability. So let's say the last story I heard was there was an old warehouse full of old medical records that was being liquidated, and instead of properly disposing of the records, they somehow got caught up in a yard sale, a donation sale, and the box was sealed, and the records were never accessed by anyone. So that was a breach because the records were not protected according to HIPAA privacy protocols. However, it was not a reportable breach because based on the risk analysis, there was no way that there was any vulnerability exposed to those records because no one had gone into the sealed box and they were not able to access it. So under the new law, it would still not be reportable, but it would require you to take the administrative steps to conduct the risk analysis. And like I said, there are tools out there that can help you do that risk analysis, and also if you look at the standards in the law. Yeah, so I will concur with my colleague Carrie. In the event of a breach, probably the best advice would be to contact legal counsel. They can also explain all of this to you. And I should note again that it hasn't been previously available, but there are new insurance policies that are targeted toward healthcare business associates that cover a lot of the expense of what happens after a breach occurs or what happens when there's a government action. And so if you have any questions about those offerings, shoot me an email and I can talk to you about that as well. What happens is, you need an attorney to advise you about what steps that you would take. If there's a reason to go in front of an administrative law judge or to cite the action, there's expenses related to that. The notification procedures can be quite expensive, and so anyway, so those are sort of new vehicles as part of your risk management strategy that you may want to consider. So hearing no additional questions, I just want to say thank you again to the Virginia Rural Health Association and the Kentucky Rural Health Association for allowing us to put this webinar on today. I hope that it was useful for you. Like I said, I will make sure that this presentation, I think we're converting it to a YouTube presentation. But I'll make sure that it's available on both our website listed here and on the VHRA website, and we'll figure out a way to get the links to you from this presentation as well. I hope you have a wonderful day, and thanks for being with us.